I'm Heather Johnson. I'm a clinical nurse on 5 West. I'm here to do a peritoneal dialysis exchange today. And
I'm Sydney. I'm an advanced clinician and I will be a patient for this exchange.
okay, great. So this is what an example of what an order and Cerner for a peritoneal dialysis exchange will look like. This patient today requires an instill with gentamicin. So when the physician orders gentamicin or any sort of antibiotic, the nurse will warm the dialysis solution in the warmer and send it down to pharmacy prior to the installation. So this patient today will get 60 milligrams of gentamicin and 2-liter bag of 1.5% dextrose solution for a minimum of 6 hours. It says in the order here to drain by cycler, but after talking with nephrologists, they say that drain by cycler doesn't necessarily need to take place. If the patient is having a cycler set up right after the installation of antibiotics, that's fine. But if it's going to be more than 6 hours prior to the cycler being set up, it is okay for a nurse to drain by manual drain. So our supplies that we need for our exchange today are obviously our dialysis solution. You see here it says 1.5% dextrose. The solutions also come in 2.5% and 4.25%. We warm the solution for a minimum of 1 hour in a CAPD warmer. We never use the microwave. We have clean caps. We have our Stay Safe organizer. Normal clean gloves, you don't need sterile gloves. And then anyone in the room during a dialysis exchange has to wear a mask. In our example today, our patient has a Baxter connector. So that is just the larger light blue end with white end here connector. At the hospital here at Sharp Memorial, we use all Fresenius products. So if your patient comes in with a Baxter connector or the light blue with white end, then you will need the extension lure lock kit. It comes in a connector that looks like this. So I will show you how to change that over. Prior to any contact with the patient or their dialysis extension tubing, we always want to wash our hands, wear clean gloves, and everyone wears a mask. Thank you. You're welcome. So I've gotten my warmed fluid back from the pharmacy. It has the antibiotics in it. Normally an exchange takes place while the patient's in bed. So we always use the bedside table. We clean it with a normal CAPD wipe or bleach wipe. We take off all of the contents that are on the table, food, water cup. We wipe the table down, let it dry so we know we have a sanitary and clean surface. A patient should be in bed during the procedure. Sometimes it can be uncomfortable during drainage and instill. So we've sanitized our area. We've applied our clean Stay Safe connector. So I'm going to change over this end of the extension tubing here. So this tubing here, it's locked off. You can tell if it's open like this, this means fluid could just drain out freely. So it should always be in a locked position. We never want to touch the end of the tubing here with our gloves. So we have our extension tubing here. Then we put on our the Fresenius tubing directly on, and it just screws on tightly. All right. So now we have our proper end for our equipment here. All right. Our tubing here, we hang, it works by gravity, so we hang on an IV pole. The end of the drainage bag here, in case there's any holes or any defects in the bag, we always place in a pink basin. The end of the drainage tubing here should be in the first position, and we place it in the Stay Safe organizer. Like this. It immediately goes to drain. Even if the patient does not have any fluid in their abdomen, we let it sit in the drain for a little while just to make sure that all of the fluid is drained out of the patient's body. So we're ready to do our drainage here. Click on our extension tubing is from the patient. So we open this up, keeping in mind not to touch the end of the tubing here. And we place this on here. So now we're clean. We open up her clamp here, and then since our patient today has the Baxter clamp, we have to open both clamps. You'll see it start to immediately drain. It works by gravity, like I said, so you can put the table up higher, you can put the patient's bed lower to help aid in the draining process. Once your patient is completely drained, you want to break the seal of your installation bag. So break this off and let all of the air come out of your tubing here by clicking over to flush. So you'll see instill fluid drain out the air along here and then go into the drainage bag. Once fluid starts going into the drainage bag, then you're free to start with the fill. So there's 3 settings in the fill. The middle setting is half flow. So imagine a garden hose clogged off half. So this slowly instills the fluid, the dialysate, into the patient. You would use that setting for someone that's new to peritoneal dialysis, or for someone that potentially has an infection and has pain. This is wide open, so this will drain. Normally can take 20 minutes or so to fill the patient completely with this 2-liter bag. Once the patient has completely full of fluid, then you turn over here to pin/close. It feels like a little click, 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 and it releases a pin, a safety pin, into the extension tubing. You'll clamp the patient off here so fluid can't drain back. And our Baxter patient here requires an extra clamp. And we already have our sterile clean cap here, so we can simply put them onto their clean cap. And your patient's done with their treatment, so they can tape that up, and generally we put it back onto their body here. At this point in time, we can take this extra cap, put it on our extension. We put this side on here so fluid doesn't leak out while we're gonna weigh our drainage bag here. We weigh it and we inspect it for any fibrin or blood clots. A normal appearing drainage bag will have just yellow in appearance. And then after we're done We can either save a bag for the nephrologist to, we just save this in the restroom usually for the nephrologist to look at and inspect the bag. You can also put a patient label on this and send it directly to the laboratory so they can do cell count or culture. Any sort of labs can be run from the bag also. So when that happens, we literally just send the whole set to the lab, and they are able to get samples from it. If you don't need to keep the bag for any reason, then we usually just drain the drainage into the toilet and put all of this into a red bag. We use this as our step-by-step resource guide. So here on 5 West, this walks through all the steps that I just did. We also have information on our website if you need other resources to help you do a manual exchange.